Hi, I'm Patrick Etland with the Commonwealth Institute for Fiscal Analysis. We're a fiscal and economic policy and advocacy organization based in Richmond, Virginia, a think tank. Every day at TCI, our expert analysts are hard at work studying the challenges facing Virginia across a range of areas, including education, healthcare, immigration, and how workers are faring in today's economy. And we publish our analysis in reports and blog posts. But we don't just look at the challenges. We use our work to develop sound policies that we think lawmakers should consider to make progress and build better, more equitable opportunity for everybody. Today, I want you to hear directly from our experts about the challenges we face in Virginia and the many policies available to lawmakers to start dealing with them.
Chris, why do you think school funding is so important?
Well, Sherry, I think it's important that everyone in Virginia has opportunity to strong, well-supported schools and training programs. From children entering preschool to adults that are looking to go back and retool their skills. It's through these types of programs that you give people real opportunities to chase their career ambitions and potentially break cycles of intergenerational poverty. It's also how you grow a talented workforce that can attract and create its own opportunities. And that can be an essential way of growing economies in struggling communities.
And what are the challenges right now?
A real challenge for Virginia is that we rely so heavily on local dollars to support schools. Not every community has the same resources to invest in school systems, and that's particularly true since the recession hit. The state dropped funding and did so in the highest poverty areas the most. And this is exactly where families and leaders have the least resources to fill in for state cuts.
So what can we do about it?
Invest. There are a lot of great investments we could be making. We can boost support for dollars targeted at high poverty communities where needs are greatest. We can also increase support for the Virginia Preschool Initiative to make sure that we're filling all available seats. And finally, we need to make sure that we have adequate staffing in our schools, and we should fund the new guidelines for critical positions like school nurses, school counselors, social workers, and school psychologists. We just need to find the will to commit to making these new and critical investments.
So Chris, let's talk about taxes and revenues.
Sure. Whether we're talking about the economy or education or healthcare, it really comes down to having the resources to make real investments into those areas and build opportunities for families across Virginia. Those are some of the areas that we've invested in the past to help us get to where we are today, and that's where we have to continue making investments to keep moving forward. Unfortunately, Virginia's tax system isn't keeping pace and is unable to meet all of our needs right now. Part of the problem is that our system was designed 30 years ago and reflects an earlier economy where incomes were much different before corporations were able to shift profits out of state or overseas to the same extent, and it really doesn't match the economy we have today.
Can you give me an example of what's outdated or what should be changed with our tax system?
Another good example is the state sales tax, which doesn't apply to many services or online purchases, in particular digital downloads of things like ebooks or music and movies. And we know more and more people are buying the latest ebook on their tablet, or instead of going to the mall to get the new CD or DVD, they're downloading a digital version from the comfort of their own living room. Because these purchases aren't taxed, that's less money to invest in roads and schools and other needs. And Virginia needs to make a relatively straightforward fix with this and treat these purchases the same as purchases from your local brick and mortar store. Virginia needs to modernize its sales tax and make changes along these lines. We've made a commitment to our communities, ourselves, everyone else, to keep up our roads and schools, and modernizing our tax system would be one way to do this.
We all want Virginia to be a place where everyone who works hard can raise their kids in a decent home, put nutritious food on the table, set a little aside for their educations and their own retirement. What can government do to help?
We've come together in the past to invest in what builds a strong economy. For example, cities invested in drinking and wastewater systems to make sure people could live and work safely in growing centers of commerce. Today, though, too many of those systems are crumbling, and modernizing them could provide good jobs in the short term and prevent catastrophe in the future. And we've come together to reduce barriers and work towards a state where everyone, no matter who they are, has a fair chance to attend good schools and be considered for decent jobs. Yet that work is clearly not finished. Today's barriers are different for different folks, yet the work of reducing them is still vitally important.
Now, you've written about particular barriers that communities face. Can you tell us some more specifics about that?
Sure. Some of the barriers are still the old barriers. Segregated neighborhoods, segregated schools where too many kids don't have the resources they need to learn and thrive. And there's also some newer barriers. We need to address the lifetime of economic and social consequences that stem from the over-policing of some neighborhoods. We also need to address the unfair restrictions on access to driver's licenses because of unrelated immigration status and court fines and fees that some folks can't afford to pay. And we need to look at the way that too many workers and businesses who play by the rules are being undermined by companies that are cheating their employees through misclassification. By working together to tear down these various barriers, we can build an economy and communities that work better for all of us.
Part of having strong communities is making sure that everyone has access to affordable and quality health care.
Unfortunately today though, almost 750,000 Virginians, including nearly 100,000 children, remain without health insurance, and hundreds of thousands of those struggle with mental illness and substance use disorder.
But we know what it takes to build a modern healthcare system that works for all of us. For example, we can build on the success of Virginia's Medicaid program, which provides access to coverage for low-income families and individuals. Also, we can build on local innovative partnerships that provide access to more uninsured Virginians. And lastly, we can work on those fully funding those most recent bipartisan recommendations.
Right. In addition, we should look to scaling up programs that are working at the local level, such as funding and training for crisis intervention teams, which help law enforcement officers divert individuals with substance use disorder and mental illness from the criminal justice system.
Overall, there are many proactive steps that we can take today to make sure that we can address the health needs of all Virginians. And we believe that our toolkit provides a broad framework for where to start.
So now you've heard a little from our experts about the challenges facing Virginia and the opportunities to make progress. We've pulled together our best thinking on these issues and opportunities in a more comprehensive format and published it in a toolkit called Building Opportunity. In the toolkit, you can take a closer look at the trends in the economy, education funding, healthcare access, and dive into opportunities to improve the state's revenues in order to help pay for the progress we need. You can find the toolkit on our website, thecommonwealthinstitute.org. Join with us to help build opportunity that doesn't leave anyone out. That's the kind of opportunity we need in Virginia. We have the tools, we need to use them.